cases like
I'm here with mid-level provider Jaime Valles. How did you feel about doing the one-on-ones with the staff?
it was fine to at least.
You've never actually done that, no? Like formally like this?
Not like this. We've done when there were issues and that kind of stuff, but not just to kind of catch up.
You think it was good?
It was good.
Better than you expected, or?
Yeah. I would hope they. Sometimes they open up a little bit more and be like, hey, this is what's going on.
But today they did.
But today they did, yeah. So it was good. It was good. So they know we're with them.
But let's go in, and then we'll talk a little bit more about your experiences as an NP, joining a site network, and things like that. So, stepping into the Denali, very nice, very demure, very cutesy. Look at this thing, guys. And Jaime Valles with the strawberry. Every nurse practitioner should eat as they tell their patients what to eat. So very good job. And then the Denali's great, man, by the way.
Thank you, man.
The first time at Denali's been in the video. So, Site Network, you know, we have an opportunity here to perhaps become a Site Network, or the platform. What are your thoughts? You know, only for those following us, it's been 3 years now. This December will be 3 years that we've been doing patient visits at YCT. So not even 3 years of doing patient visits. And that first year was, well, that first few months was me and you just messing around, you know.
Prepping everything.
Yep, prepping.
Setting a good foundation.
Doing a lot of videos at that Starbucks. I remember we're masked up on one of them. People were making fun of us for being masked. Thank you guys. It's very thoughtful of you guys to make fun of us while we were masked. But what do you think of the progress so far?
You know, as I always said, research is completely new for me, so I didn't really know what to expect. But now that I'm involved more, and it's better than I thought. You know, I like how the
better.
Yeah.
This is mid-level providers. Mid-level providers. Do you think that if more knew about this, maybe not just to be an owner, but well, here's a real question I got from a mid-level provider.
Okay.
I want to get into research. I watch your videos. I'm an NP. What do I do?
The best thing a mid-level provider, either MP or PA, can do is to find a great doctor. A doctor with good reputation, a doctor with the good practice as well, and somebody that you can work with very well. That's key. Otherwise, you probably will not get far. Once you find that, you know, get the education needed, not to make promotions, but to get Dan's book, go through his academy, and then once you do that, hire somebody who's going to be reliable. Doesn't necessarily have to know it all, but will be willing to learn and to get feedback, because here's a lot of feedback from everybody. You get feedbacks from the docs, you'll get feedbacks from the sponsors, you get feedbacks from the monitor, you get feedback from everybody. If you don't know somebody that knows, if you can get somebody experienced in research, it'll be better. If not, find somebody that it's you know, trainable, and then train them. But those are the two keys, I think. The very first one is to get a good doctor that will, you know, help you grow, and then the other one is to find somebody, or do it yourself. As far as research goes, the whole process, the forums, the 1072s, you know, familiarize yourself with EDC words, Creo, with source, you know, all that kind of stuff.
And then ultimately, if you're gonna be the site owner, right, learn how to manage staff, because the more sophisticated you get as a site owner, the less, and the more of a system you build, the less you are needed on the day-to-day. Like, I'm not really needed on any day-to-day anymore. A couple rating scales here and there, and you for physicals and things like that, but more or less they're on their own. And our job mostly becomes balancing and managing personalities, which is foreign to many mid-level providers that, you know, like yourself. You've never really, I mean, you've managed kind of MAs,
Yeah, well, I was a resource coordinator in the hospital, managing the floor, the unit with nurses and MA and CNAs, but nothing like this. This is way different. And then the other thing is, don't go in expecting to get money right away. It's gonna take some time, quite a bit of time to build it up.
That's why I love that we're documenting this, because since day one, we've been making these videos, and it's on my tab on my channel of watching our site journey, and people can go watch the first videos where we weren't sure when we're going to randomize someone.
It'll take time, but once it takes time, and once you start getting some revenue, then it snowballs, because now more sponsors know you, then you're able to get more studies, and then go from there. But in the beginning, we didn't pay ourselves for over a year, almost 2, right? But and
that's when we knew what we were doing. There's people that get into it that don't know what they're doing, and then they're gonna make mistakes. We didn't really make critical mistakes early on to delay the payment even more.
That's right.
There's site owners that double that time because they make mistakes, like critical mistakes. There's a lot of stories like that. So, and as site networks start to evolve, and Jaime, God willing, we get to launch this site network that we've been planning, and we're gonna have advice for sites that want to join a network. Right. Like, there's advantages to being part of a network.
So it's worth it. In the beginning, if you don't have enough money saved for some time, you're probably gonna have to work to have both jobs. It's doable. I did it. But it's fun. It's cool. And then once you get to know that the medications are getting approved, and you were part of the process, it's even more rewarding as well.
All right. Well, stay tuned for a lot more videos with Jaime, not just documenting our site journey at Yuma Clinical Trials in the Denali. Thoughts from the Denali could be the new playlist name, but just as far as the site network is concerned. So thank you, Jaime.
Yeah, thank you.
Mid-level providers rock. Thank you guys for your hard work.